Hi, good morning. This is Dr. Holmes Schneider at the Ozark Chiropractic Clinic, and we're here today with our next installment of our email newsletter. We're in a little different room, as you can see today, because I want to do something a little more practical today. You know, people always ask me, what are some stretches? What are some things we can do for our back if it's a little stiff, achy? So today we're going to demonstrate some things for you to do to help yourself out, because that's what I want to try to do, is help give you some practical pointers that you can use to help yourself when you have little flare-ups. As a good general rule of thumb, you know, I like to do these exercises sometimes in the mornings before you get up. That helps with that morning stiffness. That can be very common if you have chronic back problems. End of the day, after you've worked all day, or maybe you've been out working in your yard and you're feeling a little more stiffer. These are a good time to do these exercises also. So I like to do them maybe a couple times a day, and I try to make them a regular routine just to help keep stretched and limber, because it's going to help you feel better too. Also, remember, if you have new injuries, always use ice on them first. 20 minutes on, off for an hour, and do that off and on for the first 2 to 3 days. You can use moist heat afterwards for that if you'd like. Don't ever sleep on a heating pad. You sit up against it or have it on top of you, but do not lay on them and do not sleep on them all night, because it can cause burning and more swelling, so that can make things worse and such. And two, if you ever have a problem that lingers past a couple, 2 to 3 days at the most, you need to get in here and see us and things, because things are not going to get better on their own. Usually it's a sign something's going on. But let's get started here. So I'm going to take the mic off, so hopefully you'll be able to hear me all right, but mainly it's just to see what we're going to do. So with that in mind, let me go put this over here gently. So we get that right to there. All right, so we're going to lay down. Our first exercise is what we call the knee to chest stretch. You're lying on your back. You're going to take one leg at a time, and we're going to bring it up to the chest. We're going to hold it for a count of 3 to 5 breaths. Nice, easy, relaxing breaths, okay? And we're going to do each leg for that time. So again, 3 to 5 breaths, just nice, relaxed breaths, okay? So we're done with that. Then we're going to do both together. So we'll bring them both up. This is a great stretch for your hips, your lower back. It feels really good. So our next one is we're going to do what we call sort of our knee and hip rotation. We're going to push your feet on the ground like so, knees bent, and we're going to take our hips and knees and gently move them to the side, okay? This one's easier to do on the floor or in the bed, because then here I may fall off. And things, but we get 3 to 5 breaths, and we'll go each way. This is a good stretch for the lower back. The hips also generally feels really good. The next one I like to do for most folks is just a general hamstring stretch. So we're going to keep your legs straight, your knee locked, and bring that leg up as far as you can. We're going to stretch the back of the leg muscles. If you bring the foot down a little, you can feel more stretch in the calf and behind the knee. Again, hold for 3 to 5 breaths, and we'll do each leg again for that amount of time. And this is a great stretch, helps take stress off of the hamstrings, which attach to the hips and such. Now, the way to get out of bed too in the morning when you get up is don't do a sit-up. That just strains the back. So we're going to lay all the way on your side. This is how you should get out of bed. Use your hand here, and lower your legs up, and you're going to push up sideways like so. And that's a much easier way to get out of bed. It puts a lot less strain on you that way too, and such. So you get this up. So with that in mind, those are good to do, like I said, morning and evening. Helps take care of that stiffness that's there. Whenever you feel little aches or flare-ups, a good time to stretch also. And that's what we're here for. You know, if you have questions or issues, please call us and stuff. As always, you know, if you're having problems, you're concerned, or you're curious if we can help you, or if you have a neighbor or friend who wants help, we always do consultations as a complimentary service. I'll sit down and talk with you. I feel I can help you. We'll go forward to an exam. If not, we'll refer you to somebody else who can, so there's no obligation there. If we do an exam, of course, we have fees on that, and we go over that. And there's always specials we have. And if you tell the girls that you saw our video on YouTube here, I'm sure we could come up with some special for you to help you with that. But we want to reach out and help. So if there's anything we can do to help you in the future, remember to check out our website, check out the Facebook page. Always give us a call, 479-667-5053. But I want to thank you guys for your time, and have a great day. Thank you very much.